with a flood of strong emotions, while others generally adapt well to life, in fact, life changing events and stressful conditions. This involves a lot of resilience as it is the process of bouncing back through well adaptation from difficult experiences of life. Now, to shed more on this topic, we need to understand the importance of positive mental health and resilience. May I please invite Dr. Samir Parikh, Director, Department of Mental Health and Behavioral Science, Fortis National Mental Health Program, Fortis Healthcare, to address the audience and to share his thoughts. Thank you so much.
Most people would like to believe that COVID was something that brought mental health to to light, and more people have started talking about mental health post-COVID, right? Which obviously is not true. And the world on social media is actually not the only world that exists. You'll also feel that because you hear so many conversations on mental health, sometimes a well-known person talks about it, lots of people on social media are talking about it. So you may also feel that now everybody is comfortable talking about mental health, right? Which also is not true. There are almost 15 people per row, several rows going out, 1 in 7 people in each row. You should have been seen somebody from my side of the world. And if you aren't, then the fact is that you're either not aware or the stereotype that surrounds the world of mental health continues to have an impact because you aren't able to reach out and talk. Globally, 70 plus percent of people, and I'm using the word globally because I don't want a thought process also to happen where we say, is it an Indian issue? It's not an Indian issue. 70 plus percent people across the world who need to seek help from a mental health professional do not reach help primarily because there is stereotypy, they feel there is, they experience stigma, they feel they'll be discriminated against. There is also a concern around access, a bit of, and also if you look at the world, then there is around affordability and lots of other aspects around mental health. You compare the availability and access. High income countries, 70 mental psychiatrists per lakh. Low income countries, around 1. Deficit of mental health experts, around 300 odd percent in our country. So a lot of these conversations that we do in terms of mental health becomes very cliche. It's like giving those 4 or 5 tips that you would want me to give you 5 tips to solve the problems of your life. Not going to happen. There is no way it can be looked in that spectrum. But at the same time, and I appreciate this whole idea of talking about resilience, at the same time, we also need to understand the spectrum of mental health. So let's start from one side of the spectrum, which is, do I have the skill set to be able to deal with the basic ups and downs of life? Life skills, I can give education to students. I teach them physics, chemistry, maths, bio, a lot of other things. How about life skills? And life skills is not, again, cliche, social communication skills, one chapter here, write an essay on assertiveness. No, application of life skills. What do life skills do? They prepare me for a future. They prepare me for the ups and downs. They prepare me for the stresses. Alongside with that, as I move forward, and in today's world of an intrusive media, an ever pervasive media, and here when I say media, I know this is a media conclave, I talk about social media as well, in fact, largely social media. So what happens is, do I give them the media literacy, which I think is more important than other forms of education that we do? How do they deal with this? Also, if there are early concerns happening, WHO has identified bullying as one of the factors of mental health causes in adults if it is not handled well in childhood. So, what do you do in this age group? That's how you build skills, which is a spectrum who do not have concerns. Then we move forward to distress. All of us will experience distress. Distress may come in various forms. All distress does not mean you need to see a mental health professional. But that distress you need to be able to deal with. Now, whether you deal with in terms of talking to people, I've maintained talk, talk, and talk more to people if you want to solve your problems in life. But to be able to talk to people, you'll need to build relationships. To build relationships, you'll need to prioritize relationships. To prioritize relationship, you'll need to give them time. And relationships, if you think were built on text messages and emoticons, then you've been conned. Because that is the easiest path to coming to an expert like me to solve your relationship problems. If you are using text over actual words, and if you're using emoticons instead of expressions, then you are losing feelings, thoughts, and frankly, a little bit of intelligence is also seeping down and faster than what it should. This is a distress level. And then comes the illness level, which is 1 in 7 people. Depression, 280 odd million people in the world. 220 plus million people having anxiety disorders. I've just mentioned two illnesses. Do you know that if you make एक तराजू बनाते हैं, one side of it you put mental health, the other side you put diabetes, cancer, COPD, as in chronic lung diseases. Which one do you think will have more cost to the economy? Cancer, diabetes, COPD on one side, we've talked about so much, and mental health on the other. Mental health. By 2030, $6 trillion. 10 to 15% of working adults. 1 billion working days are lost per year effectively to depression and anxiety. WHO says depression and anxiety increased by 25% only during the 2 years of the pandemic. So the only solution to this third part of the spectrum is early identification, awareness, and access to treatment. Access to treatment, I think, the only way a solution in our country is digitalization. I don't think it's about people being able to reach experts physically. And I do feel that in this context, tremendous work has happened in our country. I would have never thought 20, 25 years back when I started my career that in a budget speech the finance minister would speak the words mental health. To me, that was probably the most, I can never forget that day, right? And when I kept on getting calls and messages that, did you hear this? And I said, well, I had never would have thought. So all of this needs to be seen in a perspective. All of that is important. That's how you come to the topic of resilience. What is resilience? Resilience is not merely fighting something off. Resilience is bouncing higher. Like it or not, stresses will come. Like it or not, you will go through struggles. Today, my young colleagues, upcoming medical, in the medical field, NEET exam results have come. You talk to 12th class students, you hear about board exams. How can anybody and everybody do well? I mean, come on, we lost the finals as well. Does that mean you don't play the next match? You get out at zero, does that mean that you don't score a century next time around? This is life. The word resilience is about bouncing back and bouncing higher. It's like a basketball. It'll go higher. That's resilience. How do you build resilience? You build resilience by one, skills. How do you get skills? The role of community, in my opinion, schools and colleges have a big role to play. Media has a big role to play. Mental health needs to be prioritized over most things in our life if we want to have a quality life. The second aspect, social support system. And here I'm taking example of COVID from where I started. Had talked to obviously hundreds and thousands of people during this entire aspect. Through our helpline and other work that we've done. And I realized that if you keep all variables constant and you compare outcomes between, let's say, two individuals, person A, person B, who had, let's say, the same impact of COVID in the physical space, then the outcome was different when person A had a very good support system, family, friends, neighbor, a school alumni, employer, you can pick up any of these. Vis-a-vis person B who did not have that support system, and the difference essentially was just about this. The difference was in support system. So where you look at this at one, build relationships, value relationships. Resilience is about knowing your skill set, knowing your strengths, working on your limitations. We all have more limitations than what we would like to believe, but we have many more strengths than what we recognize. Resilience is recognizing your strengths. Resistance is also being able to, without hesitation, seek help. And to seek help, you build your support system. So how and why mental health is important? Because if you take mental health away from the context of your and my life, how will you be happy? How will you do something that you like doing? How will you build relationships? Good mental health is not having an illness. Good mental health is contribution to the society, dealing with the days up and down of life, feeling good about your own self, working with your strengths. That's what good mental health is. And for this, you start from the spectrum I talked about. Skill building, early intervention, break the stigma, encourage people to talk, remind people that the core self, human self, requires more humans if you want to build into a resilient society, a resilient home, a resilient individual. And to the core of this is unmute yourself. You unmute yourself. Two sides of unmute. Unmute yourself if there is anything you struggle with, speak to someone. And the other side of it is, if somebody reaches out for help, unmute your compassion and support. To build the collective resistance of the society, psychological first aid, in my opinion, should be made almost mandatory for all of us. And all of us need to make this pledge that wherever you are, in your organization, as a media house, in your schools, in your colleges, RWA, let's look at psychological first aid so that it's not about individuals and illnesses and doctors. Expertization of mental health is not going to be a solution given the sheer prevalence and the intensity of the problem that the society is dealing with. It comes down to your support system. It comes down to our sense of collective, and that I think is important. So yes, reflect on what I have said. Most of the things that people from mental health profession like me come and talk is something we have always known. It is as common sense as it gets. The only problem is that जीवन की आपाधापी में जो most obvious चीजें होती हैं वो हम भूल जाते हैं. And then it becomes about a traffic jam here and a presentation there and an exam coming here and the result there, and then so many messages coming that you actually forget, and it's almost muscle memory that's sending a, a thumbs up sign or a heart emoticon and so on and so forth. So beyond the world of emoticons and texts, beyond the world of uh, digital exchange and using the digital world for social, and which is going to be there, core self, people need people, build relationships, value your well-being and other people's well-being, and value values. So my summary to all of you, you want to have resilience, skills, acceptance of the self, reaching out for help, not hesitating in taking the intervention that is needed to take, and most importantly, investing relationships. Resilience of a society is together we can.
That was truly enlightening, Mr. Parikh. Ladies and gentlemen, we are at the very end of the Republic Dialogues, a thought leadership program and series. The final session will revolve around how the healthcare sector has now become the heart of Indian economy and about the paradigm shift at a global level. India has clearly chalked out its potential and left a mark on the world during the pandemic. We are strengthening the healthcare system at a global level, and it is time to take the entire nation along. For the final closing keynote, I'm sorry. Right. Okay. Before the final keynote, may I also request our team to play the audio visual for our audience. Thank you. I'm sorry, there's a confusion. We will carry on with the keynote. Okay. All right, I'll take this forward. For the final closing keynote address, I would now like to invite on stage Padma Shri Professor Dr. R.K. Grover. He is the Consultant Oncologist Advisor, Sri Hanuman Balaji Charitable Trust Institute and Founder Director of Delhi State Cancer Institute, East and West Delhi. Dr. Grover is known for his contribution in the field of medicine and has over 50 scientific papers to his credit as well. Mr. Grover, welcome. Thank you so much.
The new shoes I got online.
Call it doing with style.
Yeah. Thank you so much. Thank you everyone for sitting till the fag end of the session. I'm so grateful to all of you. I'm so grateful to Republic channel, Republic Bharat. I think you are all probably Republic Bharat staff only. So you are bound to sit till the last. Doesn't matter. Thank you so much. So this is, I'm just making the last final session, and please try to be attentive. You might be tired by the since morning. You have the slide changer? You have the slide changer? Okay. Is the pointer as well? It doesn't have pointer. Laser is not there. Okay. Directed that side? Yes. Thank you. So this is what we all know. We are all aware that education and health are the